All right, welcome everybody. Good afternoon. Um, Today we have the pleasure of sitting down and having a conversation with Tish Zitzow, and she is now with Woodforest Insurance Partners, and she is prepared to share a little bit more information about a new comprehensive healthcare package that she has made available to our association and to all of our members. Um, Super high level. Members don't need to be set up as an LLC or S corp to be eligible for coverage. Uh, Multiple PPO networks, and now we're talking Blue Cross Blue Shield. Um, Actually, before I run through everything, let me not be rude and just go ahead and turn it over to a true expert. Let me introduce Tish Zitzow again from Woodforest Insurance Partners. Welcome, Tish.
Thanks, Steve. Hi, everybody. I'm only going to show you my face for just a few minutes, so that way you can focus on that. But I've met a lot of you. If I have not met you, please make sure that you visit me when during the markets. I do visit High Point, and I plan on also covering some of the other regional markets as well. So if IHFRA is there, just try and track me down, because I'll probably hang out with Steve most of the time. But I'd love to meet you in person. But I'm always at High Point. So if you ever want to sit down and talk, you need to talk about something specific, and it just happens to work out in those times, please know that I'm available in person as well. So I'm going to kill my screen, but just wanted to tell you I'm the same person with America's Healthcare Experts. I merged with Woodforest Insurance Partners so that I had more support, more back-end support, the ability to be able to better service, IHFRA. I'm really kind of dedicated to the furniture industry at this point, and I want to be available as a resource. I am a patient advocate first and foremost. So it's my responsibility to make sure that we get you with the right product, and that when it's time for you to use that product, they're paying those claims, that you're able to get the service and treatment that you need. So please know that that's really where my heart is. The insurance piece is where we're just trying to do the right thing up front. And then we really kind of, I always tell everybody I have an anger management issue and I take it out on insurance companies. So shush, don't tell that to anybody, but that's kind of my MO, because I want to make sure that you guys are getting the right care. Our whole system is broken. And so I really kind of take it as a personal vendetta to try and, force what we can do for IHFRA members, so that everyone is doing their part to make sure that you get the healthcare needs that you need. So that's it for me from a hi, how are you? So I'm going to turn off my video now, and I'm going to just go straight into the presentation. So, all right, there we go. It makes me not so nervous not being on screen all the time. Okay, so you guys know that we have had some plans available for quite some time, and they have been guaranteed issue, and we've had to do multiple things. So let's just kind of go over what those are, if I can. All right, maybe we're not going to work that way. Hold on a second, guys. I'm having a little technical issue. Give me one moment, please. Give me a second. Sorry, I don't know what's happening here.
Hey Tish, while you're fixing your screen, oh, there it goes. Never mind. I'll save my question for later.
Oh, okay. You can go ahead if you want.
I was going to say, can you tell us more about Woodforest Insurance Partners and the company itself, and how it's a recognizable brand that's nationwide, is it not?
It is. So Woodforest, so we are part of Woodforest Financial Services, which is Woodforest National Bank is part of us. And then we're also Woodforest Wealth Strategies and Insurance Partners. So Woodforest National Bank is a Texas-based privately held bank, but we're located in multiple states, and North Carolina just happens to be our second state outside of Texas of being our biggest footprint. We focus specifically from across the board. We really are tied into the commercial industry. We really want to support business owners, entrepreneurs. We do a lot of stuff with healthcare. So not only do we have just, insurance products, but we also have investment opportunities. There are commercial lenders, commercial bankers that we have available for members. And again, we're footprinted in lots of places. You might see us in Walmarts as well. That's where we have a really large footprint. But becoming a part of the Woodforest overall team brings so much specialty. I'm working with a 401k group at the moment, and we're moving over some of their deferred comp, and there's things we can do and pull all those things together. So not only are we offering individual products, but we're also going to be able to do some more intense group products that come with software platforms that make it easier for you to manage your employees. And that can be for, as small as, 2 employees if we want to go to that full platform. So we provide those additional resources free of charge, which is one of the reasons why I picked Woodforest as who I wanted to have as my support, because of their biggest space being in North Carolina. So it's Woodforest Insurance Partners. We're just a small division of the bigger corporate group, but it just gives us so many more opportunity to be able to share so much more business support for you guys. So we're not just insurance now. We can do pretty much what you need us to do. And again, the software services behind the scenes for 2 or more employees is kind of a really cool deal. And I didn't really prepare to go over that today, but maybe we can do that at a later time to really help support some more of the retailers. But that's not really who we're talking to today. But we do have a lot of options. So I'm so excited to have Woodforest as part of my team. Is that what you're looking for, Steve?
Yes, ma'am. That was perfect. Thank you.
All right. Awesome. So yeah, it's still me, guys, but just having additional resources is a huge deal. Okay, so things that we have already had. The Vault is the plan that we put in place that we launched for open enrollment last year. It was a limited benefit plan. It still exists. Please don't get me wrong. But we had to put a supplement with it so that you had primary and secondary insurance, because whenever you have just a guaranteed issue, we'll take everybody under the age of 65. That kind of gives those insurance carriers a little bit of a scare, like, I don't know what I'm walking into, right? Because coverage begins day 1. And what they want to make sure is that everything is, that they can still support the plan. So we had to do primary for the day-to-day coverage, and then, and the catastrophic coverage. But the secondary was where it came and filled in the gaps with some of those limited benefits. And I'll show those in a second. That plan and that set of plans is guaranteed issue no matter what your health conditions are. However, I'm always going to talk you through that if you are in that category of needing guaranteed issue, because we're going to make sure that that's still the best plan for you, or we're going to look and see if there's something better, because that's what IHFRA has asked me to do, has to always make sure that we're making sure what's best for you as the individual member, not for what the membership is as a whole. So if we ask for information, like if you call us or if you fill out our online application, it's coming to me and Kelly only. Kelly's my backup support. She loves the furniture industry just as much as I do. And what we're asking that information so that we can make sure that these are the best plans for you. And if not, we're going to go out and shop the market for you. So we do that free of charge for all of our IHFRA members. And we want to just make sure that we're giving you the best opportunity to have the best plan for your needs, because I do not believe in a one size fits all platform, because my needs are going to be very different than Steve's, right? I'm an aging woman and Steve's got a family. So those are 2 very different needs. And so that's what we want to make sure that we're talking through. So that's what we've had before, and we still have that in place for those who need it. But here's the big announcement, and here's the big thing. We now have Blue Cross Blue Shield federal PPO. So what does that mean? If there's a federal employee in your state, you are in network. And we all know we have state senators, because we all know where that money's going. So that means that every state has a federal employee. So that means that you have an in-network capabilities for Blue Cross Blue Shield in all of the country. Many states, like where I live in Texas, we only have HMOs for Blue Cross Blue Shield. You have to have either a full big giant group that costs you a bunch of money, or you have to have an HMO. So this is a huge deal, because not only does it allow people in my state to have a true Blue Cross Blue Shield PPO without having to have group coverage, but it also means that they can travel outside of the state or outside of their region and still have in-network coverage and not have to worry about that out-of-network program. So it is true major medical ACA compliant. That means that it is unlimited in nature. That means if it's medically necessary, it must be required. Now, I always get people ask me, well, what about fertility? Fertility is not medically necessary. It's considered an elective. So it's not going to be covered, but it's not covered on most things. So I just want to kind of put that out there. But if it is medically necessary, the plan covers it. There are no waiting periods or pre-existing condition exclusions, but there are 10 questions that we have to answer no to allow us to be able to put you on that plan. For those people who cannot answer no to those questions, and I'm going to show those in just a moment, guys, who cannot answer no, we will default back to the vault, or we'll look and see if there's something else, again, depending on where we're at. It is very simplified. It takes about 5 minutes to enroll, and we have all kinds of brochures and websites, and I'll go through that in a moment. So here's the traditional plan that we had before, which is a limited benefit plan that we need a supplement to fill in the gap. So if you'll notice, the pricing is here on the left of the page, and the pricing kind of shows you what the basic and pro, what's the difference between the two? One has a $250 deductible with a $7,500 max out of pocket. The pro has a 0 deductible with a $4,000 max out of pocket. That uses PHCS, which stands for Private Healthcare Systems, PPO, to add and to fill in some of the gaps where we have some of the limitations, where you only can have a certain number of days in the hospital per year, how many times you can have surgery per year. I always suggest that we add Manhattan Life's bundle, and it's called First Choice. And what that is it comes in and helps fill in those gaps. And if you'll notice, the pricing on the left bottom is where we have that additional pricing. So add that to the top to make sure that you get, the right coverage you need. When you bring in that First Choice piece, however, it brings in an additional PPO called First Health, which is an Aetna PPO. So you actually have dual PPO coverage when you have the primary and secondary. But we have a lot of people that get a little confused with that. And again, it's it can take a little bit of time to learn how to use primary and secondary, but you're going to learn how to do it when you get Medicare. Okay. So when you're Medicare age, you're going to have your Medicare and your Medicare supplement. That's just how it works. You have primary and secondary. So you're going to, if it's confusing now, you're going to still learn it later, but at least you know that it is something you would already be prepared for if we were going to Medicare. So this is for everyone, no matter your age. Everyone under 65 can have this plan, no matter your health conditions. But again, let's make sure we talk through that. This is the secondary plan that comes in to bundle it, to make sure that we have all the additional pieces. As you can see, there's plan 1, plan 2, plan 3. So each of them just provides additional details on what that is. Again, if this is the plan that we're going to put together for you, this is one of those things that we're going to talk through that. We're going to make sure you understand how your plan works, and we make sure that all of the pieces are going to plug in for you specifically. Now, here comes the big one. This is the way we want to do it if you can qualify. And again, these questions are very basic, but this is designed specifically for reps, guys. It's really for you guys, 1 or 2 employees, if needed. It is unlimited. We can put it out 75 days out. Every plan starts on the 1st of the month. So I always tell everybody, we need to enroll you by the 15th for the 1st of the month coverage. So that way we make sure you have coverage. That's year round. Okay, so that means we can do it all year long. You do not have to wait for open enrollment if you're ready to move. We can move you today. Okay, so then your plan will start at the 1st of the month. These are for, run your own business. You have a very small group, because when you actually go into Blue Cross and ask for a group, I have a group right now with Blue Cross Blue Shield of Texas, and it's an HMO plan, and it is a high deductible plan, meaning nothing's covered, and they're paying $2,500 a month for that plan. Okay, just because they want that PPO. So we're already talking them moving because they own a little design shop here. So that's kind of what we're looking at, is they have 3 employees that they're paying that kind of money for, when we can really come in and pretty much cut their costs in half. And that's what this is because it does have a little bit of that underwriting. We can do it up to the age of 64 and dependents up to the age 26. Because this is ACA compliant, that means that your traditional group and ACA, also known as Obamacare, also known as Marketplace, all of those things, they have certain rules and regulations, and this follows exactly what those rules and regulations are. So if you had coverage at your old work, this is going to mirror that. If you had coverage off the Marketplace, it's going to mirror it and be better for access. Here's those questions. I'm not going to read all of them to you, but I can kind of tell you it has to do, in the past 5 years. Everything is in the past 5 years, okay? Heart attack, cancer, stroke, if you've been incapacitated due to a medical condition, autoimmune diseases such as lupus, HIV, hemophilia, IBS, past 5 years, kidneys, lung, heart transplant, or any kind of dialysis. If anyone's pregnant or expecting, and again, if someone is, we just have to wait until that baby comes, because it's illegal to move someone. if anyone is being treated for a condition for which they've been hospitalized in the past 5 years. COPD, emphysema, cerebral palsy, muscular dystrophy. I always get questions on the back coverage when it says back disorders. All right. So if you're seeing a chiropractor for maintenance, that is not considered a back disorder. You're taking care of your back. A back disorder is going to be degenerative disc disease, things that you actually have disease for. So that one gets a little bit questionable. So we'll want to talk through that one if you have any kind of back issues. 5 years for substance abuse or substance dependency. If you're a type 1 diabetic, we're going to have to go to the other plan. And then if you have surgery scheduled or you're still under care for surgery, let's say, for instance, you had shoulder surgery last month, we need to get released from the doctor from PT before we can move you. Okay. So that's just kind of how those plans work. That's kind of an overview of those questions. Again, anybody who asks for a quote for, who want to see what this is, we will send these underwriting questions to you at that time as well, so you'll know exactly. Blue Cross Blue Shield, here's our network. There are some lower cost options that I'm going to kind of mention that still use PHCS. So, but if you're in the Northeast at all, unless you are in the true South, I would stay with the Blue Cross all day, except for Florida. Always go with Blue Cross with Florida. Additional stuff that comes with these plans. I wouldn't look at the bottom, the part, anything but the middle. The middle is what we're going to talk about. Got coaching, telemedicine is free, patient assistance program that helps you if you need assistance in getting things pushed through insurance. Guess what, guys? That's my job. I'll take care of it. You don't have to call anybody. RX importation programs. I always talk about pharmacy because people don't understand how important the pharmacy piece of your program is, whether or not you take a drug or not. But having a pharmacy benefit manager does two things. A, it makes sure that you're paying the least amount for your pharmacy benefits, but it also makes sure that they kind of back check. They make sure that if one doctor has prescribed one thing and another doctor prescribes another, what they put together is they come in and make sure that you're not doing anything that maybe those two doctors didn't talk, or maybe they don't know, to make sure you don't have any counter effects of taking dual products. So I always emphasize having a good pharmacy benefit manager. Not only helps keep your costs down and make sure the formularies stay up to date, but it also kind of helps you from a health perspective that you don't get conflicting and side effects that you shouldn't get. Diabetes management, again, for type 2 diabetes, we actually have a full program. If you're type 1, you can't have it. If you get type 1 after the fact, I think it's juvenile, so it's kind of hard to do that. But if you get, let's say you have a kid and they end up with type 1, if they are already on the plan, that's fine. Again, anything that comes up once you're on the plan is guaranteed renewable going forward. So it's anything up to date that we have to look at, but anything going forward is 100% covered as per the plan conditions. Imaging, balanced billing, EAP, employee assistance program. That's going to be like if you need help with substance abuse or dependency, those kind of things. They can provide counseling free of service. There's well-being apps. I'm not going to go over that. Pre-certification and case management. Let's say, for instance, like me, I had a hip replacement a couple of years ago. I'm really going to put my age out there. I was the same age as Prince, so let's just make sure that we're all being okay. Hip replacement. So I had a case manager during that, because not only did I have to have home care when I first got home, then after that I had to have physical therapy. So having a case manager allows you to kind of get stepped through that process of, all right, so now your next step should be this, and I'm going to help you find somebody. And that's what case management is. And especially, I'll use my husband. He had open heart surgery and had a heart aneurysm, and then had a pacemaker while we were in there. It was crazy. But he had a case manager that made sure all those things got taken care of, and all our follow-up doctors were made, because sometimes we have people that don't have a wife that nags them like me. So that helps you do all those kind of things. Medical equipment services is going to be your sleep apnea machines. It's going to be the pacemaker machines, anything that requires medical equipment. If it would be covered under, the ACA, then it's going to be covered under this plan. So the plans we're going to focus on are Blue Cross Blue Shield. Okay, we have the metal plans, which are $1,500 platinum, $2,500 gold, $5,000 bronze, and $7,350 copper. I'm sorry, it's not platinum. That is wrong. I'm so sorry. It's supposed to be copper, bronze, silver, gold. So that's how they work. And those metals are based on trying to make it simple for everybody. So if you get a silver plan on the marketplace and a silver plan here, the co-insurance should be the same. That's how they work. We also now, this has come up so many times when I've talked to members, that we now offer an HSA plan, meaning that you can still participate in your health savings account. I can't set up the HSAs, but we can, I can help you get that done. And then we would have an HSA plan available that is still also Blue Cross. So again, the 7350 I talk about a lot because it's the most affordable. They are age-based. Doesn't matter where you live. We do have a few states we cannot write this plan, and I'll show you those in just a moment. But no matter where you live, no matter other than your tiers, that's where your price is. So if you're 45, you're going to pay, stay in there for 9 years in that same tier. So if you'll notice, everything is copay based. What does that mean? Even if you have this big scary deductible, because that happens a lot, they're like, oh my God, that's a big deductible. You still get to go see your doctor for $25. You still get to see a specialist for $40. All of your preventative care is at no charge. And then urgent cares are $60. And if you'll notice on the left column, it says in network and the right column is out of network. So that means you have coverage in and out of network for everything except for pharmacy visits and convenient care retail clinics. Okay, that a retail clinic is not the same as an urgent care. It's kind of like your fast doctors. It's how they bill it. So, I would always just stay in network when you can and try and see your primary provider, or just look up networks, because we'll be able to, look you up anywhere. If you're traveling, we're happy to hear from that. But this is kind of the plan that I sell the most of. So I think that you guys will really enjoy this product if you're somewhat healthy. If you don't want to take that risk, this is the $5,000 plan. Same thing. Here's the deal. Every single plan has the exact same out-of-pocket max. So that's the thing, is everybody is 7350. It's just how much faster you're out of pocket versus, they are. Same 25, 40, and $60 copays. And the only thing on the, all plans have pharmacy benefits. But the only thing is, the plans that are specialty drugs, and those are going to be the drugs that have commercials on television. If you're taking a drug with a commercial on television, this plan's not going to cover it. That doesn't mean that we can't work with you to try and see if we can't find you as an off plan, or it doesn't mean that we can't help you try and get manufacturers coupons. But those drugs that are done on television, they have to pay for all that advertising. So we're going to see if we can't find you a generic, an alternative, or we'll try and see what you got and what you got going on. So just know that that's one of those, the plans that are one of the products that we cannot cover. And it's even hard to get some of those specialty drugs on major medical ACA as well, because there are other options and doctors are getting, paid money to sell those. So that's what it's really important for you guys to understand. 2,500, again, here's the pricing. This is all available on the website, and I'm going to show you that. So I'm not going to spend a whole lot of time. But again, it just kind of shows you all of them have the same max out of pocket of $73.50. All of them are priced in a tier bracket. Ages 55 to 64. I'm going to be in that age bracket next year. That is the most expensive time to have health insurance, no matter where you're at, no matter what your carrier, no matter what you got going on. That is always going to be the most expensive time to have health insurance, of course, right? Because we're wanting to retire, and now that's going to be a cost. If we are wanting to retire and we're not going to be working anymore, and you're not going to be 65 yet, that is definitely when to get us involved. And here's why: because you will start qualifying for additional incentives. There's subsidies, but I call them incentives, because they started targeting 55 to 64 on ACA for better subsidized premiums. So if you are getting to that, where you want to consider that, let's make sure we talk by Zoom or something, so we can really make sure we're doing the right thing and not just putting you into an expensive plan because that's how old you are. Again, here's it's more kind of broken down. This is kind of the sheet that I send to everybody, so you can kind of see the different prices. The prices are about 10 to 12% less for the same plan designs using the PHCS PPO network. That stands for Private Healthcare Systems. It's the same PPO network that the Vault, which is the guaranteed issue plan, uses. So we can always play with that if that's going to be a better cost for you to get down, because maybe it's a little pricey and you really just still want to have something. We can, again, make sure we talk about that. It is, like I said, 10 to 12% less, but I really wanted to focus on Blue Cross because that has been the common denominator of the questions I get. Do we have anything like Blue Cross or Cigna or anything of that nature? So Blue Cross, we worked hard on this one. We've been trying for 4 years and we finally got it. So I'm excited for you guys. All right, so now I'm going to just kind of jump over real quick, and I'm going to share my screen of This is what your landing page is going to look like when you log in. Okay. Or when you click on it. Steve is updating our website today on you guys' stuff. And if you'll notice these programs all up top, all of these are the PHCS plans. Okay, so that's that private healthcare systems. If you want to talk and look at Blue Cross, this is where we're going to be looking. Okay, so it says BCBS. The deductibles are pretty much explanatory. Here's that HSA we talked about. This cannabis, all right, for whoever's listening, it's only available in California. All right. So if you want to talk to me about cannabis, we'll have to talk about that offline. But everybody else can have the other plans. And this is where I'm talking about those signature, specialty drugs. We kind of have a little bit of options to be able to add those in. So it's giving us the ability to really give you what you've asked for and what you've needed. There's more info available on each one of these that kind of show, a line item detail of that little grid that I sent to you. We've got a full summary of benefits. Here's your provider search available. Pricing, you just put in your age. I get this a lot. My husband's older than me. They go by what they call the employee. So if you are the rep, then you are the one that they are going to put the prices on. If your spouse is working for you, but they're younger, hint, hint, they're going to be the employee. So just make sure, again, if you want to talk through that a little bit with me, just holler. Brochure, you can download the full brochures here, all the legalese and all that kind of stuff. Here's the biggest challenge I have. There are several states where your laws are a little bit tricky, that we're not able to cover you. California, New Hampshire, Oregon, Vermont, Washington, and that's it, because the rest of them are and New Hampshire. New Hampshire's the other one, if I didn't say that. All the rest of them are in Canada, Ontario, and all that. If you live in Washington, Oregon, California, New Hampshire, we will look at the vault plan for you, or we'll look and see if there's something available based on what you need. That West Coast deal is tough to do just based on the laws, especially that have merged in from California up north. So we've got options, but we cannot do Blue Cross Blue Shield. Kaiser won't let you. That's kind of, if I'll just give you the answer, Kaiser won't let you. So that's what the landing page looks like. We still have the other landing page for that guaranteed issue. And that looks like this. So if we are doing guaranteed issue, this page looks like that. You can click on the health plan overviews and it'll pop up a little PDF here. So you can look at that, and then it kind of comes in and you can pop up you gotta close this out. And then you pop up all the other, pieces of the supplemental policies, etc. But don't worry about trying to get to the right page. That's kind of my gig. You just reach out to me. Here's my email address. You can go directly to that website. You can also it's tishzitzow.com. We are still transitioning all of our branding to the website. So right now it still has me as the sole person, but just know that I've got the other team. This is we didn't merge together until February. So we're still doing a lot of that compliance stuff to make sure that we're there. So I think that I try not to talk too fast, but here's the problem, guys. I'm married to a man from New Jersey, and I have to talk fast if I'm going to word in. So I don't know if we've had any questions or anything, or anything else that I can answer. Or Steve, what do you think? That kind of sums me up for today.
Very well said. And as someone from New York, I take offense to that. I try to slow down.
It's in New Jersey, man.
I know. I would honestly, I think if anyone on the call has questions, if your time allows, if your schedule allows for it, I'd love to just have a few minutes where folks could chime in with their question.
I have plenty of time. I had you guys scheduled for a full hour. So if anyone does have a specific question, if you want to put it in the chat box, I'm happy to answer them live. And then again, you can always get me at that phone number. And my email address is there if you have quick questions that you don't want to, discuss out in the broad opening. But it's Blue Cross, guys. It's what you asked for, and I'm excited to have it for you. And again, we will support whatever changes that you need. So I don't see any more questions popping up.
No, thank you.
Oh, absolutely, Barbara Jean. It was great
Yeah,
to
that
talk
was
to you
great.
today. Okay, if no one else has any questions. Oh, we got two. There we go. Let me
Hang
see.
on,
Thank
I
you
think
so
they're
much.
starting to pop in.
There they are. Would you evaluate our current plans and make recommendations? Absolutely, Jay. Just go ahead and send those over to me. And then it says, my wife and I work together as reps. All right, that's fine. We would probably still do a husband-wife plan, and whoever's younger, we're going to use your age. If you're in the same, price, you're in the same age tier, it really doesn't matter, but we always try and do the younger one. I missed most of the beginning of the meeting. Do we have access to the recording? Yes, that we have recorded this meeting and it will be loaded up. I'll let Steve answer that just a little bit more.
Yep, probably by end of day. So we'll
Okay.
have this available real quick.
Yes, Jay, your wife can be primary. All right. How does it affect you when you transition after 5 years of pre-existing conditions? How does it affect you when you transition after 5 years? It just, we just reapply you or we apply you after the 5 years. Hi, Patty. We apply you after
Hi.
after you've gone through your 5 years of whatever treatment you were having, and you're 5 years free. And that means if you were finished on May 37th, goodness, May 31st, we can have you coverage June 1. So we would just need to apply you as soon as you're 5 years clear, and you won't have pre-existing conditions, and whatever condition you had been treated for 5 years prior would not be considered pre-existing. So let's say, for instance, you had cancer in 2019. As soon as we got past the date in 2019, if you've been in remission that long, then you immediately can come onto the plan. And if you get cancer again, once you're on the plan, it's covered. I think that answered. Is that what you were asking, Patty?
You're amazing. Thank you.
You're
you guys
welcome.
have been extremely helpful.
Awesome.
You answered just about every question.
Awesome. All right. It was great talking to you, Patty. What is the pricing of the basic plan? Well, it's all the basic plan not being Blue Cross. I can go back to that. Give me just a minute to get all the pieces going. So basic, that's going to be with the PHCS limited benefit plan. I'm assuming that's what you're asking for. Those plans run about 538. Oops, went one too far too many. Okay. 538.53 is the basic plan. But we can put you on, and that's the guaranteed issue. The least expensive Blue Cross plan, depending on your age, is going to be, within about $60-$75 of that, depending on your age. My daughter works for me and she is 33. Can she get coverage? Absolutely. If she is a rep, she can have coverage. We would need to talk to IHFRA offline because she needs to probably become a member. So that's a different discussion. But yeah, we can absolutely positively get her covered. She would have her own standalone policy, just like as a grown up. So I know they're always our babies, but that's what we get to. All right, I think that answered all the questions. If I missed anybody, let me know. But I think that was it. Steve, am I good? Oops.
I think so. So then just to clarify, one of the screenshots showed, or better yet, when you're sharing the screen, can you go a la carte with some of the Blue Cross plans and say like that RX booster if you have one of those fancy specialty drugs?
Yeah, absolutely. So let's say that you're happy with your health plan or you're getting a subsidy, but they're not coming from your drugs. We can absolutely a la carte just do that piece. Because guys, we also offer vision and dental and all those other pieces, because I didn't focus on that at all today. Okay. I really wanted to focus on the health piece, but we can do a la carte. You just need vision insurance. Okay. You just need dental insurance. Okay. You just need short-term disability insurance. Okay. We can do one piece. We can do all the pieces. We can do just health. We can just do, like the RX plan. Yes, everything is a la carte. It doesn't make a difference from a pricing perspective. If you take one or another, that's just kind of how the program works.
Okay. And no, other than the 10 questions, if someone wanted to get on the Blue Cross Blue Shield plan, if one, need to be a member to be able to tap into the association plan, and then two, just be able to answer those 10 questions or answer no to those 10 questions. But there's nothing else like being an LLC, S corp, or anything like that.
Nothing else at all. And that's kind of some of the things that that I'm glad about, because this is really truly made for you guys. It's made for reps entrepreneurs. It's specifically made for you guys that are out on the streets kicking it in your 1099 worlds. And that's exactly what this is built for.
That's wonderful.
You're fantastic. Thank you.
Thanks, Patty. It was great to see you this time around.
No, I almost missed it.
I'm glad to have you around. All right, Steve, is there anything else we need to cover?
Let's see. Someone's got another question just saying, can you send me those 10 questions?
Yeah, Eric,
I'm sure there's a link that we can send, right?
Yeah, whenever, yeah, so the link to get to everything, well, you know what? I will send the underwriting questions. They're right here on the screen right now. But I'll send these to Steve and we'll just put them up, make them available as part of the webinar. That way you'll be able to look at it and see it from there, because the underwriting questions don't really come up as much whenever you're like in the info part. So anytime I give someone a quote, I immediately send this with it. So that way you can see that, okay, I just need to wait for, a couple more months or whatever. But yeah, Eric, you can also, if you want to, just private chat me your email address. I'll shoot it to you directly.
Cool. Yeah, Tish, I think otherwise we are all set. So once again, thank you so much for your time today, Tish, and for all the information and for this exciting new plan. I'm really looking forward to it. And I appreciate everyone carving out some time today to jump on and educate themselves about this new plan.
Thanks everybody for coming. Again, if you're ever at market, come find me. I'd love to talk to you and meet you in person. And thanks again, Steve, for allowing us to be involved with IHFRA. We love you guys.
Yeah, we love you back. And Jodette, yes, that is correct. That was the question I had as well too. There's no need to be set up as an LLC. Yeah,
you're all safe. Okay, guys. Well, I hope you have a very blessed week. And make sure you take care of your mamas if they're still around. If they're not around, hugs and prayers to you. And happy Mother's Day.
Thank you, Tish. You too.
All right.
All right, everyone take care.
Thank you. Thank you.